This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
There's just such a buzz of energy with everyone coming together in person from the very first moment that we kicked off the conference all the way through the various dinners that we had. Everyone was excited to talk to each other, lots of sharing, lots of connecting going on.
Hello and welcome to Sg2 Perspectives. I'm your host, Tori Richie. Today, we are going to debrief on our annual Sg2 Summit series. I've got Brianna, Motley, and Bill Woodson here with me today. Brianna, Bill, great to have you.
Great to be here, Tori.
Thank you.
Brianna, give us the elevator pitch for Sg2 Summit. What is it? Who attends it? How is it organized?
Well, this year has been exciting, Tori, because we have transformed our summit experience into an Sg2 Summit. We were fortunate this year to have a cross-section of members across executives, academic medical centers, children's hospitals. We had a little under 300 attendees across those three sections. This is our opportunity to release all of our latest thinking, our latest thought leadership to our members. We spend about 3 days talking through all of the topics that are top of mind for healthcare executives in those different persona types. We take them through discussion and dialogue. What are the trends? What is the data showing us? So what are we seeing from a future forecast point of view? And then we also give them plenty of opportunity to network because with the complexity that we're faced with in healthcare, it's so important to learn from your peers and hear from others and share stories and work together to problem solve.
On the note of networking, it was a concerted effort this year to add additional networking sessions with the group, and the engagement of members as they got to interface with their peers far and away. This was the most interactive that I've seen the group in any of the years that I've been to Summit.
That's right, Tori. There is just such a buzz of energy with everyone coming together in person from the very first moment that we kicked off the conference all the way through the various dinners that we had. Everyone was excited to talk to each other. There were plenty of requests for business cards, LinkedIn requests. People came up to me to ask, can you meet with this organization? So lots of sharing, lots of connecting going on.
Bill, you and Rebecca did our opening keynote where we identified a handful of different assumptions to common questions. Can you walk through some of the key takeaways there?
4 major assumptions, and our goal was to not rip them apart, but to challenge them a bit and to expand the assumptions that many of our members are operating under. There are 4 of them: policy, consumerism, scale/personalization, and the role of strategy. Under each, we try to paint a reality and also get some feedback, which happened through other sessions. On the policy side, we encouraged our members to pay attention to the federal issues that they know a good bit about now. In fact, our sessions on site-neutral payment and Medicaid were oversubscribed. We also said you need to pay attention at the state level now. And in the course of several days, I've heard from individuals about the dynamics in their states, Vermont, Indiana, Arkansas, and how tense that next level of regulation or scrutiny or accreditation or pricing pressure is going to be for them. That's just the next piece of a really complicated puzzle. What surprised me a bit is how worried our members are about the impact of policy financially. More than I expected. That was palpable in the room. So that's policy. Second is consumerism, where we challenged our members to say or to think that it's more than just access. It's about the experience and the relationship that you're building or trying to establish with the patients. Having said that, access has stagnated. And Brianna, I think you got a quote about access that you heard from one of the academic health systems.
I did. It was very thought-provoking. The more that we make progress on access, the more access challenges we have, because the notion of trying to solve one problem, open and address access and capacity challenges in one area of the system, when you have such a comprehensive system of care, access challenges then present in another area of the system. It's obviously complex, it's multifaceted, and when you solve one problem, you have to move on to the next and leverage data to be able to understand where those bottlenecks are.
I love that quote, but listeners, don't use that as an excuse for not solving access challenges. You want to get on to solve the next problem.
You have to take that first step. You have to solve that first access bottleneck before you can move on.
On the access side, we tried to back it up from our own Vizient data called the CPSC that looks at wait times, and also the Merritt-Hawkins survey. Especially that's the hardest to get into nationally right now is OBGYN, and the average wait time is 42 days to get an appointment, which is extraordinary. And the wait time for an office visit in Boston is more than 60 days right now. We have a long way to go. Having said that, we've looked at other consumer data that tells us there's work to do. We used a statistic about 2 in 5 consumers have switched primary care physicians in the last 3 years, which to me is a startling number. And what's the reason? We actually have the factors that weigh into that, and there are a bunch, but it's that desire to have a relationship that matters more and more. But it's also access. If I can't get in, I will be willing to switch. And just a reminder that we have some powerful data on trust. The level of trust in hospitals/physicians across 20 surveys now has plummeted. For example, in the 65 plus group about 4 years ago, it was at 83%. Now it's at 48%. In the 45 to 64 group, it was 72. Now it's at 37. That tells us we are not as sticky as we'd like to be. Our brands are not as powerful. Policy, first assumption, consumerism, the second. The third is about scale and personalization, which is a large topic. We tried to say there is great promise there because of AI, and we mentioned aspects of AI that are going to help with personalization at scale in several talks, including those on innovation and our academic systems that are here today. What comes up is cancer and the potential and the challenges of using cellular genetic therapies, policy, consumerism, personalization, and scale. The last is the role of strategy right now, and we try to emphasize, because we learn this more and more from our members, is the importance of communication and prioritization. I had a great quote for that, which is from one system that said, if we can ask 3 people what the top 3 priorities are in the organization at any one time, and we get the same answer from those 3 people, we've achieved something. It's surprisingly hard to do, and that is a sign of systemness we may talk about in a moment.
And you gave a really great acronym in that fourth one, Bill, which I know stood out to some of the members because I heard them mention it. Was it SCRIPT?
Yeah, it's SCRIPT.
They summarize SCRIPT as the importance of being simple in your mission statement, your vision statement, not having paragraphs upon paragraphs, but boiling it down to 6 words that everyone in the organization can repeat.
So SCRIPT is an acronym for simple, consistent, results-oriented, intentional, personal, two-way. And that's all healthcare needs is another acronym. We can probably do a separate podcast on this topic.
On that point of personalization, it's really pushing providers to move beyond that transactional care delivery. And too often, I experience it when I engage with my providers as well. It's how do you get the provider to take your healthcare concerns seriously? And the fact that that's contributing to so much leakage, there's so much more awareness as well and conversation with consumers on, I shouldn't have to go to multiple doctors to get a diagnosis. There's so much more that we should be pushing our physician counterparts to do to help enable that personalization and that coordination of care.
The flip side of it came up in other sessions about privacy. For example, we can do ambient documentation now and ambient scribing. That's recorded in a certain way, and consumers may be uneasy about that. We're also adopting facial recognition technology in different aspects of the healthcare system. That can also be uncomfortable, but we're using it to personalize and to accelerate access. There's a tension.
Does that then contribute to consumers perhaps not being as honest as they should be in those interactions because they're nervous that it's going to slip out that they have certain lifestyle behaviors or are part of certain demographic populations or what have you? That's very scary to think about. Bill, you talked about innovation and technology. That's always a major conversation at Exec Summit. Is there anything that's especially exciting to you this year as it relates to NNTech?
There's a bunch of things in the service line breakout sessions that I won't do justice to. I heard a lot about AI, its potential and where we are, and we're a year later and we've come a long way. As most industries have, the promise of it grows more important even as we struggle to scale it. There's a great quote from Robert Lord, who's a Vizient leader on AI, and he reminded everyone in the audience that no one in any industry is more than 9 months ahead of anyone else. Therefore, healthcare need not be last, as we've been with many technology or innovation changes over the last decade. We heard the term agentic AI, which would mean in a practical case, now we have the ability to flag patients who might be at risk for sepsis. The next step would be an agent that would then trigger a whole set of interactions with that patient and contact that patient and contact the patient's family. These tools are available to us and we're going to steadily adopt them. We heard practical models now on the administrative side about using AI tools to help us with pre-authorization, documentation, claims review, accreditation, and even to evaluate the progress we're making on our own plans right now. These are accelerator tools. And I love another quote we got, which is, we are never going to win the war for talent. We're going to have to use some of these AI capabilities and tools to help us to personalize and to get to a number. So for example, on the workforce, one number said, if we look at our math on our income statement, let's say our labor expense right now is 52% of the total. We're probably going to have to get it down to 48%. We're not sure how to do that. We don't even know what that means yet, but AI is going to be a piece of that puzzle.
The other thing that I heard within that AI discussion that I thought was powerful and important to not be lost or left behind was the importance of doing the pre-work. We have to move with pace, and we do have an opportunity to not be that industry that is adopting last. We also have to do the hard work of, number one, defining the problem that we're trying to solve, and then layering AI on top of that, doing the work to redesign the pathways or the processes versus just plugging AI in as a solution. I thought that was important.
That is a rule that we should apply to all process redesign conversations that we have within the healthcare landscape.
Our colleague Andrew addressed the pace of all this and gave us the cautionary note at the end. Moving too slowly is a path to obsolescence. What comes after that is recovery. And that's what we're trying to avoid as the rest of the world moves very quickly to adopt these tools. Recognizing that they are tools is also part of what we're working on right now.
There was also a connection between doing the pre-work and making sure that you are redesigning those care delivery pathways or those processes and starting from ground zero with what our external keynote at the end of the conference talked about. So we had the good fortune of having Josh Linkner, and I'm not going to give away his entire talk, but one of his points was you have to burn the blueprints. That really speaks to if you're going to harness and move forward innovation and move it forward with pace, start with a blank slate. Don't try and reinvent something that has existed forever. Ask the question of why are we doing this way? And what if we flipped it on its head, did it differently, and burned the plan for how we're doing it today? A little bit more challenging in healthcare, given the regulatory environment, obviously, but that thinking and mindset adoption is essential.
I love implementing that new orthodoxy and how it is that we go about strategic development. I think it's awesome. Where do you think we've made progress? We're 12 months out from our 2024 Exec Summit. Where have we made strides in the last year?
We just mentioned AI. We have made strides. The other topic, as much as I don't like the term, is systemness. I don't know how much progress we've made, but there is an awareness, there's an acknowledgement of the things that we have to do to achieve it. And we had a panel with 2 leaders from Norton Healthcare. We asked them to define it, and there are, of course, many ways to define it. But the simple definition that one of them used was it's about cohesion, and cohesion that drives better outcomes and better performance. They were quick to point out there are negative sides to systemness, and I want to quote this directly here, but systemness, if it's done incorrectly, can cause lack of balance and poor performance if the elements are not aligned. And local level culture can be lost, as well as consumerism may be affected. It's important to explain the why to the broader stakeholders. Otherwise, the decisions could be received differently. That's a lot to say, but it gets to the reality of the trust that's involved in creating a level of systemness in the organization and tying it to things on the ground and making decisions and the tough calls, getting into topics like service distribution, what's going to be on each campus, how do we differentiate, Brianna will comment on that, and how we're going to get our strategic planning done differently.
I do believe we advanced the conversation there. The other place that is a topic we've talked about for several years now is consumer strategy. There's always interest in consumer strategy, but I do believe this was the first year, and we had the great fortune of having a leader from Freighter Theta Care Health who made the point essentially that the consumer experience is transforming. And we all know that, but the way that he put it was that we're in an experience world, not a product world. It's hard to think of healthcare as a product necessarily that you're delivering. It's not a product, it's a service. But if you think of those two things synonymously, and we take into consideration all of the data that Bill shared earlier on how consumers are choosing to access care, how they're stringing together their healthcare using different options, we also have to reframe our thinking as being in an experience world. And how do we adapt what we're delivering to adjust to that and to meet those expectations and demands?
I love that. That can be such a good differentiator because what we hear so often from traditional healthcare providers is we're losing patients to these disruptors. We're losing patients to these platforms that exist on our phones, or they're packaged in these very well designed websites or what have you. But when you start to really look at the underpinnings of a lot of the private equity backed services, they don't offer any different service than what a traditional health system does, but they market it in a way that's much easier to digest for the patient. Engage engage patients and engage consumers in a way that's going to drive stickiness with them and it means something to them. I'm curious, thinking about all of the great conversations that we've had over the last week, what is something that you heard from a member that stood out?
I could think of several things. We have to remind ourselves how much variation there is out there. We work hard on our forecast about the shift in surgery to ambulatory settings, and that is a topic we get a lot of questions about. I talked to 2 members who said, we're just not experiencing that in our market. We don't know why. We're not being hurt yet by it. The physicians aren't moving quickly, and we're still operating under the old model. And they're anxious about how quickly it's going to change. Another surprising comment that I heard was, Bill, we got through COVID without doing any layoffs. We've been a disciplined, resilient organization. What we sense coming on the side of Medicaid because of our payer mix is going to threaten our ability to do what we've always done. And we're having discussions behind the scenes of what we're going to eliminate programmatically and how it's going to affect tough decisions on our workforce. One more topic that comes up and we need to focus more on, it's overlooked, and that is pharmacy. Individually, when I talk to health systems, they do want to talk about it. Academic systems are very much on top of this because for 2 systems we had on a panel, for them, pharmacy, especially pharmacy in particular, is growing 30% year over year. It's more than $1 billion business for each of those organizations. The head of pharmacy for Yale New Haven Health System, or Yale Health, said, let's think ahead 10 years where therapeutics will probably be larger than the procedure business that we have today. There are different numbers of what that might be. Will therapeutics be 40%, 50% of spend in healthcare? That's a humbling thought and will cause us to restructure, reorient our whole philosophy of what health systems exist to do.
Hearing that panel, I was going through the same type of mental gymnastics of what it would mean to flip healthcare delivery on its head. Forever, we've prioritized how do we maximize surgical procedures. And if we are increasingly shifting toward that medicalization of the population, how do we reframe our strategy conversations? How do we ensure that we're investing in different sites of care, but they're different sites of care? They're not your ASCs or your hospital outpatient departments. They're industrial-sized warehouses that can store these medications without them spoiling. It's figuring out how to streamline then delivery of these medications to a broader community. It's totally transforming the way that the healthcare system operates.
2 things that I heard from members that struck me. Number one, coming back to Bill's favorite topic of systemness. Systemness does not equal standardization. And that is why so many people chirk at that word, is they think you're asking you to do the same thing in every single place in the same way. In another conversation, I heard someone say that it's about intentional variations. It's not about standardization. You obviously don't want unintentional variation, especially when it comes to quality and outcomes. Being able to focus on the intentional variation and that simple point of making the decision and it being more active than passive certainly stood out to me. Bill mentioned differentiation as we started talking, and that was a theme through and through. That was a pleasure for us to hear because it's something that we've been talking about at Sg2 for so long. It's not enough to say, we're going to get into this business because everybody else is providing the service and we want to compete. You have to be able to define where you are truly differentiated in the services that you're offering. And we did hear one leader say they had a single meeting, I don't know how long, probably half day, full day retreat around 2 priorities. And one of those questions that they set out to answer is, where can we be differentiated? Not we need to provide this service in every single place in our system, but what can we do at each of our sites that will be different from what we're doing in other locations?
Brianna, I believe it was in our member from Ohio State who had a quote. I'm not going to do it justice, but it was something like, if you want to go fast, do it alone. And if you want to do it right, you got to do it together. That was a great balance of what it's going to take right now to be successful. We lean heavily on the future is about partnerships, and more partnerships than you have today.
One of those elements in partnerships, and we heard this theme from partnerships, but also from executive leadership teams, is the importance of trust. And it seems so obvious, but it's actually not. Trust and communication are those underlying success factors that people don't necessarily always pay attention to, but it underlies everything you do, whether that's working with a partner or working with your other executive leaders. As we try to advance the ball in an increasingly competitive game, you have to trust each other.
While Exec Summit is exhausting for a whole lot of different reasons, it's so much work, it's so much networking, it's so much presenting. There's a lot that goes into it. Coming out of the summit each year, I do feel a new rush of then motivation. I get excited to then get back to work and think about how we're going to solve some of these questions for our members. I'm curious from each of you, what are you most looking forward to digging into deeper coming off of these conversations with members?
Tori, it was your discussion about the intersection of strategy and operations with some really powerful examples about creating capacity. One from the University of Colorado, where they found capacity, I think that equated to 114 beds, and also from Northwestern and their emergency department. Those were breakthroughs that surprised me, the achievement there. So the intersection of strategy and operations, and then different measures or new metrics for ROI. We're going to be asked for that in ways that incorporate data elements that we have, but we not harnessed effectively yet, and those relate to clinical care, operations, and other aspects of the workforce. I'm excited to work on that.
Bill, I'm going to come back again to your favorite word, systemness, but we did receive lots of questions about, especially as systems are getting bigger, they're spanning larger geographical regions. There are questions of how can you help us dissect how much progress we've made on being able to support distribution? And is the leakage that we're seeing in one facility because it's being retained in another one of our system facilities, or is it truly going elsewhere? And I know that we have the data to be able to answer a lot of those questions. We haven't necessarily looked at it in that way, but we could come up with some really powerful analyses to support all of the conversations that are happening around M&A and around systemness.
I love that. I love both of those answers because the magic of SG2 is going beyond just being a convener of information. It's going beyond just aggregating data, insights that exist out there, and actually pushing forward the thinking of health systems across the country. That gives us plenty to sink our teeth into for the next 6 months or so of this calendar year. For those who weren't able to attend this year's summit or they want to revisit some of the content, how can they access more information on what it is that we covered?
If you are a member, this year you will be able to access all of the presentations that we delivered, not the panels and fireside chats, but all of the presentations that we delivered have been pre-recorded and will be released on our Sg2 Intelligence website. So head there to be able to see the recordings of those videos. I know there were some breakout sessions that were oversubscribed, so we're so grateful that those will be available to members. And if you are not a member, I imagine that we will have a summary post. I know that we had a lot of good notes, transcripts, recordings that we'll be using to put together a summary post to release to both members and non-members on some of the insights that we shared today and others as well.
Awesome. Thank you so much, Bill and Brianna.
Thanks for listening. If you like this episode, please subscribe, rate, and review us, and or follow us on Twitter and LinkedIn at Sg2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, Sg2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You could find them at Vizient /podcasts. Have a great day.